Delaware, John Carney. Governor, thanks so much for joining us. Delaware starting what's being described, Governor, as a limited reopening this Friday. Many businesses can open for curbside pickup, for example. You're allowing hair salons and barbershops to open to what are described as essential workers only. Why do you feel comfortable taking these initial steps?
Well, first of all, on a number of our criteria indicators, percent positive cases, we're doing a lot more testing, so we have to take the percentage of those tests as positive, declining over a 14-day period of time, hospitalizations declining over a 14-day period of time, new hospitalizations on a day-to-day basis with a 5-day rolling average on the decline. Are we ready with PPE to protect healthcare workers? Are we ready with our expanded testing and contact tracing? And so what we're trying to do is have a little bit of a rolling reopening, interim steps between now and when we move to stage one, which we're not ready for. We want to strike the right balance between protecting vulnerable populations and containing the spread across our state, which seems to be working, except for one hotspot in the lower part of our state, and allowing some accommodations so businesses can go back to do limited commerce, whatever they're doing. Previously,
you did want to see 28 days of declining cases before reopened. Now you've gone down to 14. Why the change?
You know, nothing's changed there, Wolf. It's a first interval of 14 days to take you to stage one, and then another interval of 14 days with those declining indicators and with a green light on the other criteria on our dashboard, the PPE, protections for vulnerable citizens, and the testing and contact tracing. So it's still the same approach, 2 intervals of 14 days, gradually moving to an opening.
Your stay-at-home order, I understand, Governor, is in effect until the end of next week. Do you plan to extend it past May 15th?
Yeah, it looks like we will extend it past May 15th, Wolf, just to be sure about these indicators that everything on those 14-day intervals are moving in the right direction, and we're seeing that now. We still have an outbreak in the lower part of our state, which we're really leaning into with additional testing of poultry workers, with additional testing and folks that live in those communities, and with outreach with public health workers to provide assistance to those families. And so, yeah, we will still look at those 2 intervals and extend the stay at home. And by the way, the new normal is not going to be like things used to be. You know, we still need to limit large gatherings. We still need to have social distancing in public. And the challenge is, and somebody mentioned it in your interview, is, you know, this idea of mixed messages, right? You want to be sure that you continue with the message that folks need to continue the practices of social distancing while we're reopening sectors of the economy in a safe and sound way, not in a way that people were used to before. We'll be talking about mask wearing. We'll be talking about separation inside facilities. We'll still be talking about no large gatherings. Dr. Birx kind of hit it really on the head the other day when she said, when you think about it, it's just doing 50% less of the social interaction, going to the grocery store, going to the pharmacy, that you would normally do. That'll help us to keep that reproduction rate below 1, which is where we need to be so that the virus doesn't
very
spread
quickly,
in our state.
Governor, I know you got to run, but very quickly, you have some very popular, beautiful beaches in Delaware. I can personally testify to that. Are you going to open up those beaches?
Yeah, so we're not ready to open the beaches yet. I have a meeting with the beach town mayors tomorrow. They have a number of concerns. Already they're open for walking and exercise as long as people observe social distancing, surf fishing on the beaches, but not open for sunbathing and swimming. And they won't be open for those activities for some time.
All right, Governor, thank you so much for joining us, Governor Carney of Delaware. Appreciate it very much. I know you're very, very busy. Thank you.
Thank you, Wolf.
Up next, the new study suggests another possible treatment for people severely ill with coronavirus. Stand by, we have new information. We'll also take a closer look at the new study showing African Americans are dying in very disproportionate numbers. Much more coming up right here in The Situation Room.